Then came started the Indo-French Foundation with Alan Tibier and many of these senior cardiologists, myself, Dr. A.B. Mehta, Dr. Matthew, Dr. Ashok Seth, and all these things. So this we had 3 meetings in India and Europe. And through this foundation, many of the young cardiologists who are reputed cardiologists in India now were sent to France for training. Then 90 to 92, 2000, lot of changes that took place. First forgiveness, cardiopulmonary support, angioplasty was done in Jaslock Hospital 90 by Dr. A.B. Mehta and Dr. Pailadani. That time, the machine was a big machine. Dr. Saul used to, I think he developed that machine. That was the first case done in Jaslock Hospital. First bare metal stent came in, I think the Purushottam Lal did it in Apollo, Chennai. It was published in Indian Heart Journal. Primary angioplasty with elective coronary stenting in acute myocardial infarction was published from East Gambhir and his group from J.B. Pant in 95. Also, there was a large publication for primary stenting in acute MI from A.B. Mehta and group from Bombay. First indigenous stent was developed by Dr. Kamaraju, it's called Kalam Raju stent in 96, and it was first put in Medicity Hospital, Hyderabad. I did that time the radial angioplasty was coming in. I saw in Europe PCR and came and did the first case in 94. It was published in Jabi. Then came the era of beyond balloon and stent. Came the directional atherectomy, and Ashok Seth did the first case in 92. It was widely published in the local press. And then came a follow-up of primary lung balloon angioplasty versus rotablation for lesion more than 10 millimeter by Dr. Gambhir and his team. That was published in Indian Heart Journal 95. Then came the era of left vein interventions started by Dr. Gambhir, and first few cases was done, and it was published in Indian Heart Journal by Gambhir and his team from J.B. Pant Hospital in 98. Then I accidentally did a patient in 97, doing a radial angiogram, and patient the radial artery went into spasm, and I said, why not all that? So I did it. It was published in local press, and I sent it to Indian Heart Journal. It was rejected. But that was in 97. But in 2002, the Japanese colleagues, Tachilima and all that, they reported the first case of translunar angiogram, and it was published. So I just, because of my laziness, I didn't publish it, but it was published in local journal with photo and everything. It was titled "A New Passage to the Heart." Then came the era of drop-out stent. I did it in 2002. And then this PTCA moved to the hand. The two large publications from Tejas Patel and his group from Ahmedabad, they did it in primary angioplasty, and they published their data, coronary angiography and angioplasty, to the transradial approach in the Indian Heart Journal in 2008. In 2005, I published my data on coronary angiogram and intervention through transalnar approach. That was first in India. That was published in Indian Heart Journal. But I must give credit to Dr. Tejas Patel and Dr. Chuk for making transradial interventions very popular. And Dr. Tejas Patel started the TRICO meeting, which was very popular. And he published also 3 volumes of book by Patel's Atlas of Transradial Interventions. Dr. Sanjay Chuk started the meeting, Radial Life meeting from 2005. He also published a very successful, very nice book, Handbook of Transradial Interventions. I also contributed in this. So credit must go to these two gentlemen for making transradial interventions very popular in India. Then the era of imaging started and high-risk PCI. First impala case in 2007 was done by Ashok Seth. Intravascular imaging started coming in. From India, I first published the first series of optical coherence tomography in PCI, initial experience from Apollo Hospital, Hyderabad. This was published in Indian Heart Journal and in 2013. And also that time, this is now it has come a clinical expert consensus document on the use of percussion-led ventricular assist devices during complex high-risk PCI in India using standardized algorithm. This was published recently in Asian Journal of Intervention. Ashok Seth and many of the cardiologists, interventional cardiologists contributed from India, contributed to this. Then came acute MI intervention. Dr. Thomas Alexander from Coimbatore started the STEMI India program, and this he propagated throughout to many meetings, many publications. This has been a global model for low and middle income countries. It is adopted by European Society of Cardiology in the ACC, and this model was published in many international journals, and this has become a model from India which is being followed in other countries throughout the world. And CSI came out with a consensus document, framework for National STEMI program, consensus document developed by STEMI India, Cardiology Society of India and Association API, Thomas Alexander, Ajit Mulasari and many others developed this I wrote this article which was published in Indian Heart Journal. Then in between came many devices. One of the PTMR, percutaneous transmitral revascularization, which are used in patients where bypass angioplasty was not possible and patients were still having angina. I used many cases. It was in Upendra Kaul did a lot of cases and a lot of publication came. But there was a trial which showed that it doesn't have much benefit. It just slowly disappeared. In instant restenosis after bare metal stent was a real problem, and to treat it came a lot of beta cat, gamma cat, intracoronary radiation. In course of time, it disappeared. Abjad then came in big way in 2000. It came to India in 2000, I think 2002, and but in 2017, the Abbas company went to that. That time, Merrill from India came out with observable stent, and 3 years clinical follow-up was very good, and with imaging. This was presented in Europecia in 2019 by Ashok Seth. Many of the Indian cardiologists participated, and I think this has come with a new hope. They dropped the observable stent from India in the future. Then in 2020 to 24, a lot of devices came, mainly for calcium modification like IVL, orbital uptrectomy, laser. Use of drug-coated balloon increased, and zero contrast PCI became more. Patients with renal failure started. Dr. Pratap Kumar is one of them. I think he has a presentation in Indian Heart Journal. It's already there. Absolute zero contrast percussion coronary intervention under intravascular guidance in chronic kidney disease patients. Robotic angioplasty came with a lot of hope. I also had one for last 3 years, but last year the company, Siemens company, stopped the production. Only one company is there in France who is developing this. Do not know what will be its future. SOC trial was presented by Ashok Seth, a SOC trial from India registry, and it's a real world registry for coronary intravascular lithotripsy. It was presented by Europecia, highly appreciated. Lot of important meetings in India try to teach and promote coronary interventions. Most important is NIC meeting which started in 88, And every year we have the NIC meeting, and people, young cardiologists look forward for this meeting to present their cases. And this is the most successful meeting and is going on from 88 onwards regularly for every year. We have in 2010, India Life started also, A.B. Mehta, Dr. Matthew, Upendra Kalan Bale. IJCTO started by this with Indo-Japanese CTO club, Pratap Kumar, Surya Prakash, Goel and Ganesh Kripa, who is also very familiar. TIP CTO, DCT India, Winter, AICT Asia, SKIP is a dedicated meeting for imaging, which I attended recently in Kochi, a very good meeting. We also have imaging and physiological counselor. So we have many meetings who has been there for last few years. They are trying to teach and propagate interventional procedures in India. This is the data this year, 2023, data from Interventional Council data. I'm thankful to Dr. P.K. Sahu, Chairman of Interventional Council Committee Society, who provided me this data. The coronary interventions has increased. Now it is around 6.5 lakhs in India, but this is around 75%, 25% are not reported with logistic legal things. So roughly it is around 10 lakhs in India. This is cath lab. We have a lot of cath labs where we have interventional imaging devices, almost 40%, 583, but huge it 44%. But IBC and OCT only 10%, but use is very less. Only 6% IBS use, 2 to 3% is OCT, and less than 2% OCT, FFR, IFR. So even though we have 40% patient labs have these facilities, use is very, very limited, and this probably because of the cost, the inertia of the cardiologist. And this is the number of primary acute MI interventions, which is around 20%, which is very good. And it's like this, it's increased slightly, but around 20% presently. Stents mostly is a dropout stent, almost 99%. BR metal stent is gone, I think. The companies have stopped producing in parameter. Calcium management, all these new devices are being used, and this use is increasing, like cutting balloon, rota, laser, every use is increasing. I think more and more complex cases are coming, and doctors are, cardiologists are handling more complex cases, so the use of all these devices are increased, and so that's. Then story of balloon valvuloplasty. In India, we started in GB Pant by Dr. Khalilullah, and also same day it was done by AIMS, Dr. Srivastava, and Dr. Locke came from Boston. He was from Massachusetts General Hospital. Started in GB Pant and AIMS. This was published in '85 by New England Journal of Medicine. And then another important publication was from Nizam's, where when Dr. Jenton Turi came, and it was a double-blind trial between BMB and open surgical mitral valvotomy, commissurotomy. Result was almost equal. So that is the true landmark trial in BMB in the beginning stage. So started in GB Pant AIMS in '85, initially with 2 balloon catheters. BMB with balloon catheter again came into India and became more popular. We also have another kind of BMB with bifold catheter, then came metallic commissure. So these are some of the landmark publications on mitral valvuloplasty. Beside those two NHM publication came from by Satyavan Sharma published in early stages. He published 200 in '93, 200 patients using balloon. Then from George Joseph from TMC Vellore presented first case series of transtubular mitral valvuloplasty in the world in '97. This was published in Catheters and Cardiovascular Diagnosis. I was using a bifold catheter, single catheter with two balloon attached to it, and this was published in '98 in Catheters in Cardiovascular Diagnosis. This was the largest series with bifold. Then came the metallic commissionatum. Metallic commissionatum came with the idea, was developed by Alan Fever, with the idea that it can be used many times. The cost will come down. And because balloon that time, you can use it 2 to 3 times. So with that aim, and one company, medical company in France, they supported this. And the first publication, with first 7 cases we did in Apollo Hyderabad, which was published in Lancet. Subsequently, multi-centric trial started. Again, there are a lot of publication circulation and other places. But after 4 years, the result was very good. It was as good as balloon. Balloon like valvuloplasty, and the device could be reused 5, 6, 7, 8 times. But the company stopped manufacturing the device because it didn't make any sense for them, because it was not profitable at all, and because it was being reused. So there was a premature end to the dream of doing PMB with less cost that period, and no other company was willing to take up because it was economically not viable. Then we had this balloon pulmonary valvuloplasty, tricuspid valvuloplasty, balloon all started in GB Pant by Dr. Khalilullah, and initial publications were all from there. Thanks to Dr. Khalilullah, he started this interventional cardiology in GB Pant and gave responsibility to each to different people, Dr. Tyagi, Dr. Arora, Dr. Gambhir, Dr. K.K. Sethi, and pushed them to do the thing. We got trained in different places, and this was the initial problem. Of course, now we have balloon valvuloplasty, pulmonary valvuloplasty. These are the statistics of last year. It shows that PMB it's not going off. It's just like that, because I think our mitral stenosis cases are coming down, and other cases renal angioplasty again started by Sanjay Tyagi in GB Pant. First few publications by Sanjay Tyagi and his team, and coarctation also again started in GB Pant, and the first few publications were there. First cover stent was done in Delhi by Dr. Atul Mathur, Dr. Savitri Srivastava, I think yes. Carotid angioplasty, again it became a hot that time, and the first one was done in CMC Fellow by George Joseph, and this was the initial publications. There was a large series published in 2008 from Madras Medical Mission by Mulasari and his colleagues, and I published in 2003 artery stenting with filter protection 30 cases. That was published in Indian Artery. Arteritis intervention is very specific to India. It started again in GB Pant, but the greatest publication, large publication, was by Dr. George Joseph. It was published in JCC in 2023, largest series of intervention in Takashi arteritis in the world. And Dr. Mantosh Panja edited a very excellent book on arteritis, and it's called Non-Specific after Dr. Mantosh Panja. This was a reference, this was a very textbook which is referred to on all about arteritis. CSI came up with a monogram in Takashi arteritis, edited by Dr. Tyagi, Dr. George Joseph, and Dr. Devabrata. It was an excellent monogram. These two books are usually referred to when you talk of arteritis. Intervention in aneurysm, and that also started in few centers, but the largest series was from CMC Vellore, and Dr. George Joseph did a lot of cases with fenestrated aortic endograph. This was published in Journal of Endovascular Therapy and Circulation 2020. And these are the different series. It shows that slowly all these peripheral interventions are increasing, and all alcohol, everything is being done in India, and I don't have to go through. This is a pediatric intervention again started in first was the skin balloon arterial septostomy, which was done by Dr. I.P. Shikumar, who was my professor in CMC Vellore. He was a pediatric cardiologist. And then Dr. A.B. Mehta did it in Bombay in 1976-74. And the first AST, PDA, VST was from Jimipur. These are the landmark publications in pediatric cardiology. Pediatric cardiology mostly now gone to pediatric cardiologists, but largest series of transcatheter cover stent exclusion of superior sinus venous defect that came from Chennai Madras Medical Mission. That's and this is recently a 2023 the different catheter-based frontal completion without prior surgical preparation. This innovative technique. This was from Apollo Chennai and Muthukuman and his parents. Then transcatheter closure of perimembranous ventricular septal defect using Konar MF. Konar, this is a device developed in Hyderabad by Dr. Nageshwar Rao and his team, and it's becoming popular because the complication rate is less. And there is also an early multicentric experience with new balloon expanded myval in transcatheter heart valve dysfunction, then was right ventricular outflow tract conduit. This was a this is also a very unique thing from India. These are all different procedures done in pediatric interventions. Then comes the structural interventions, and the first one is again done by Dr. Ashok Seth in 2004 with a core valve in a patient with severe patient with air. This was the first implant in the world, first successful core valve implant in the world. Then the surgical colleagues, they did the valve implantation, first success that was reported in Indian Heart Journal, transapical from Madras Medical Mission. The first publication of initial experience came from Ashok Seth and his team from Escorts. And then the series came from 70 volumes from Chennai with its early experience with in 2018, which was published in Indian Heart. Mitral clip becoming slowly popular. First case again, Ashok Seth did it. Everything Ashok Seth did looks like India first. Total number till date is 417. Total center performing 64. And good thing is, it's being developed, prototype is being developed and being investigated in India in made in India devices, which will bring down the cost significantly. I think it is on its way. These are the TAVI procedure done in India. Approximately around 2000 last year, 50% is minor. These are the structural meetings which are very popular in India. India Valve, started in 2017 by Ashok Seth, Ravinder Singh and others. We started in Hyderabad Valve in 2019. I had a meeting last month. Lot of attendance, lot of interest, youngsters. Continent meeting, one in Dr. Satish does it in Chennai. Future of coronary intervention, I think precision PCA is going to the future. Image and physiological guided interventions going to be more and more. AI will drive all these interventions because AI is going to tell you what to use, when to use, how to use. And metal-free PCA is going to take over. I think around only 20% will be DS, others will be balloon observable balloon and all these things. Emphasis will be more on aggressive secondary prevention. 9A implant devices already on the market. That is going to in structural interventions, low profile tower is going to come. 9A is already on the way. Durable valve, one valve in one life for one life, that is going to go future. With one valve, we just don't worry about the years. Future of coronary access is going to be dedicated valves and mitral and tricuspid position are going to come. So in certain future, it's going to be more exciting The interventional procedure is going to be more simple and more durable. Thank you very much for your time.
Thank you, Professor Rath, for this authentic presentation of the interventional cardiology development in India. I think Professor Kavila, who is the father of interventional cardiology, is here. So I would just like to add that we at GB Pant Hospital, Dr. Professor Kavila added the laser interventions for the peripheral vascular disease. Then ASD device closer were first started by Professor Kavila, and ASD, PDA, and all types of devices, and different types of devices were used in the initial phases. And I was witness being a young cardiologist assistant to Professor Kavila. And I would like to congratulate you for this brilliant presentation, which will go into the history of intervention cardiology in India.
So it's a really wonderful exposition of the journey of PCI and structural heart disease in India. We went from 1987 or 85. But I must say that today the positions are quite encouraging, and more younger cardiologists are doing intervention after getting training in this country. And we hope that with the passage of time, we will get more such expert cardiologists, which will be nothing less than any advanced center across the globe. So I must congratulate Dr. President giving us all the information about the history of PCI from the initiation in this country. Thank you very much.
Ladies and gentlemen, that brings us to the end of the presidential oration. The plenary session, we'd like to thank the chairpersons and Dr. Rath for enlightening us. We move on to session number 85. That's the keynote address. And we'll have 4 presentations for 15 minutes each. And then the last 2 to 3 minutes will take up the closing comments by the chair. May I have the pleasure of inviting the chairpersons. Please welcome in